Hi, my name is Anthony Tran. I'll be doing my parasitology presentation. These are the things that we'll be discussing today. So I'll first introduce you to the veterinarian slash professor that I interviewed. We'll then go through the three most common slash problematic parasites. I'll choose one of those parasites and discuss its epidemiology, a case history about it, some research about it, and I'll introduce another parasite that's unusual. Yeah, so this is Dr. Laura Williams. She's a licensed veterinarian at the Washington Animal Disease Diagnostic Laboratory at Washington State University. She earned a Doctor of Veterinary Medicine in 2013 and completed a pathology residency and doctoral program in 2018 at the university. She's board certified in anatomic pathology and parasitology by the American College of Veterinary Microbiologists. And there are 50 veterinarians board certified by the ACVM, and she's the only one in Washington, so that's really inspiring. Um, what's important to gather from the slide is that her diagnostic lab collects samples from Pullman, Washington. Washington is a humid and wet place, and in that area, people like to hike, camp, and swim a lot, so it provides context on why she chose these three most common slash problematic parasites that I'll introduce now. Giardia duodenalis. I'll be talking it in my epidemiology, case history, and research slides, so I won't go too in depth with it. Um, it doesn't really have a common name. Its phylum is Metamonada. It's a protozoan flagellate, meaning it has that flagella for locomotion and cessation. It's split into 8 genetic assemblages A through H. Assemblages A and B have broad host range, meaning they can affect and transmit to more than one host, making them potentially zoonotic. Assemblages D, which is host specific, is most common and problematic for Dr. Williams as they primarily infect dogs. This is a Hymonchus contortus. Its common name is barber's pole worm. Its phylum is Nematoda, so it's part of the Helminth group. For its life cycle, the sheep or goat, which is the host, ingests the larva. The larvae mature into adult worms. Adult worms lay eggs in abomasum, or the fourth stomach. Eggs are shed in feces. Eggs hatch into larvae. Larvae molts in the environment and become infective. Um, this is a direct life cycle, and the disease it causes is hymonchosis. And some symptoms of that disease is anemia, which is a lack of healthy red blood cells, and oedema, which is swelling by excess fluid, and death. And the problem with this parasite is it's resist antihelminthic drugs, which is why I'll go into this later, but it's important to practice sustainable solutions. Dr. Williams encourages, improving management than relying on dewormers. So this is Emeria. Emeria doesn't really have a common name. Its phylum is part of Apicomplexa. The host, cattle, poultry, sheep, or goat ingest oocysts. The oocysts release sporozoites. Sporozoites reproduce in intestines and eventually produce oocysts. Oocysts are shed in feces. Oocysts sporulate in the environment and become infective. And this is a direct life cycle. The disease the parasite cause is coccidiosis, and some symptoms of that is diarrhea, weight loss. And to treat it, it's treated with anticoccidial medications that treat the parasitic disease in the intestinal tract. So now we'll talk about the epidemiology of G. duodenalis. So for the life cycle of G. duodenalis, what happens is the cyst gets shed in feces and can survive in harsh environments for months. Animals or humans ingest the cyst. Trophozoites exit the cyst in the small intestine. Trophozoites multiply by binary fission, and trophozoites form a cyst around itself as it moves towards the colon. So for the modes of transmission of G. duodenalis, it's fecal oral, and this comes from ingesting water, food, or being around surfaces that contain feces that has the cyst in it. Um, for transmission between animals and other animals, it's your dog or cat can end up ingesting poop from another dog or cat, or they might roll or play in contaminated areas and lick their bodies after, or they may drink from contaminated water sources. And when it comes to transmission between animals and humans, um, it could happen by ingesting feces, which can lead to infection. But however, humans are unlikely to get a Giardia infection from animals compared to getting it from another human. Um, so because since Giardia is can be host specific depending on the assemblage. When it comes to preventing the spread from animals to other animals and reinfection, it's important to bathe your dog or cat to remove feces from their fur, um, remove feces from outside or litter boxes, limit your dog or cat from accessing creeks, ponds, and other bodies of water. When it comes to preventing spread from animals to humans, make sure to wear gloves when cleaning and disinfecting toys, food and water bowls, litter boxes, etc., and to wash your hands after touching pets, feces, or their supplies. This is going to be about the case history of G. duodenalis. So the subject was a border collie breed dog. They were 5 years old. The symptoms is lucent acute diarrhea, weight loss, dehydration, and the test that was done was a fecal flotation. So a fecal flotation, what happens is a small amount of stool is mixed with this liquid, and the mixture is left to sit, allowing the parasite cyst to float to the top. The cysts are collected from the surface using a glass slide, and the slide is examined under a microscope to identify any parasites. But in this case, no cyst was detected. Another test that was done was a SNAP test. So what happened here is a stool sample was collected and placed in the SNAP test device. There's this special chemical that reacts with antigens, and in this case, they were looking for Giardia antigens, and the test has a built-in mechanism that produces a color change or some other indicator that tells you that Giardia antigens are there. And what happened is they did detect Giardia antigens. Um, so based on those symptoms and tests, Dr. Williams came up with a diagnosis that G. duodenalis assemblage D causes giardiasis in dogs. Um, Giardia infects the small intestine and disrupts nutrient absorption, resulting in diarrhea. Diarrhea contributes to weight loss and dehydration. Giardia cysts get shed intermittently, so a fecal sample may not contain cysts, and a fecal flotation may not detect cysts. The SNAP test detects Giardia antigens, so this confirms their presence. For treatment, the dog was put on fenbendazole, and that is a dewormer used to treat intestinal parasites, and in this case, he used specifically Safeguard, and the dog was put on for 3 days, and after that, Giardia symptoms cleared. Some additional notes is that a 4-month-old puppy was in the presence of the 5-year-old dog infected with Giardia. The puppy showed no symptoms, but a fecal flotation test showed many cysts, demonstrating that infected animals can be asymptomatic. And on the right side, I have this image of a Giardia cyst under a microscope. Now I'm going to go into some research about G. duodenalis. So these are some recent research about that parasite. This is the taxonomy. So G. duodenalis has been classified into different assemblages based on genetic differences. But however, recent research has been classifying them by species name. Their naming is of these species is determined by host specificity, genetics, and morphology, and it just allows for more accuracy and clarity. There is some research in G. duodenalis pathogenesis, its immune response to Giardia. I know that eosinophils targets parasites. There's recent research on how these type of cells control Giardia infections. There's also genetic factors affecting infection severity. So, like variations in the host immune genes and the parasite's virulence factors can lead to differences in infection outcomes, ranging from asymptomatic to severe diarrhea. Like when I was discussing about how the dog in the case study, the 5-year-old dog, had symptoms, whereas the puppy didn't have any symptoms. And lastly, stress, diet, and environmental factors triggering symptomatic infections. Maybe poor nutrition, high stress levels, and exposure to pollutants can trigger or exacerbate the symptoms of giardiasis. So there's been recent research on the prevalence and distribution of Giardia infections in developing and developed countries. Despite them being prevalent worldwide, there are higher rates of infections in developing countries, possibly because of poor sanitation and limited access to clean water. There's seasonal peaks of Giardia infections during warmer months. Giardiasis cases would peak during warmer months, particularly around maybe late summer or early fall in Washington, since they thrive in these warm, humid climates. There's also an increase in outdoor activities during this time, so this increases the risk of exposure to contaminated water. There's also higher infection rates in young age groups. So when you look on the graph on the right, when you look at the 0 to 4 years age group, it has a higher rate of Giardia infections compared to other age groups. Although from 1995 to 2016, this infection rate has decreased, which is really good. There's been some research in G. duodenalis in wild versus domestic animals. Like there's research in genotype distribution, like how I talked earlier about the assemblages of G. duodenalis. It helps doing this research helps us understand how the parasite transmits in wild or domestic animals, and some are host specific, and others can transmit cross species, or some are zoonotic, where the parasite goes from animal to humans. There's some research in genetic diversity. Some G. duodenalis are more resistant than others in these domestic or wild animals. So speaking of resistance, heavy use of dewormers has led to the development of drug resistance in these parasites in goats and sheep. The parasite that was once susceptible to the treatment can now survive and reproduce. Drug resistance is caused by genetic mutations or other adaptive behaviors. Um, what Dr. Williams recommends is just improved management. So that means picking up manure regularly. This prevents the buildup of parasitic cysts, which can contaminate the environment and affect the animals. Avoid overcrowding animals and practice good sanitation. Animals kept in tight spaces increases stress levels, and I mentioned earlier that stress levels may contribute to the virulence of G. duodenalis. Um, they're also more likely to spread the parasite when they're overcrowded. And another thing is to feed animals properly and use dewormers as directed. Good nutrition enhances animals' immune system. Another thing is, they won't be so hungry to the point where they would consume. This is an abnormal behavior, but they would consume feces. And although eliminating the use of dewormers seems kind of unlikely, when using it, it's important to follow the veterinary recommendations on the timing and dosage to ensure that the treatment is effective. So an unusual parasite that I'll be talking about today is Echinococcus multilocularis. This is a parasite that Dr. William has been encountering more in her work. Echinococcus multilocularis, its phylum is Platyhelminthes. Its common name is fox tapeworm. The life cycle, it's what happens is the adult worms release eggs in the small intestine of the definite host, in this case the foxes. Eggs get shed in feces and are infectious. The intermediate hosts, the rodents, ingest the eggs. Eggs hatch into oncospheres in the small intestine. Oncospheres penetrate the intestinal wall and migrate to various organs. Oncosphere forms a cyst that proliferates by outward budding. Protosclerosis develop within these cysts. Definite host ingest the cysts containing organs of the intermediate host. Protosclerosis exit the cyst and attach to the intestinal wall. Protosclerosis develop into adult worms. Um, as an overview, the parasite typically cycles between wild foxes and rodents. Rodents get the hydatid cyst through the eggs in feces, while foxes eat the infected rodents and get the cyst in the organs of the rodents. Humans or other animals could accidentally ingest the eggs of the tapeworm by coming into contact with fox feces. It becomes a problem for the humans or other animals since they're accidental hosts. Since humans and other animals are accidental hosts to E. multilocularis, this can result in hydatid disease. Hydatid disease is a parasitic infection that causes cysts to grow in the liver and other organs. The cyst acts like a cancer. It spreads to other organs and forms large masses, making it hard to treat. In some cases for humans, the entire liver must get removed, and for animals, it is treatable, but it can reach to the point where it's severe, where it's a grave prognosis. Some symptoms of hydatid disease is bloody stool, abdominal pain, vomiting, and potentially it can reach the point where it results in anaphylaxis, a severe allergic reaction or death. And some tests to diagnose the disease is imaging exams, which looks for the cyst, and blood tests, which detects antibodies produced by the immune system in response to the infection. Prevention and treatment, humans or animals could accidentally ingest the eggs of the E. multilocularis by drinking contaminated water, eating contaminated foods, or interacting with infected foxes. So it's important that humans do not consume anything that may have come into contact with fox feces, to wash their hands frequently, to regularly deworm pets under the guidance of a veterinarian. Most common treatments is medication. I think benzimidazoles destroy parasites and shrink cysts, and surgery. And, that's everything. Thank you so much. And these are my references.